When you, because a lot of people, when they get into, I've noticed some people get into professions, let's say engineering, law, or medicine, and they study for years and they get the certifications and they do it, and then they enter the industry. Maybe medicine's a little different because I think it requires more dedication than the other ones, but a lot of times people will study those professions and then enter the field and it wasn't what they expected and they don't like it and they tend to make a shift. So how was your experience when you were actually finally in the field and working, as a pharmacist and then working in the pharmaceutical industry?
So, I really, it's a great question. I really noticed or appreciated the value of a pharmacy degree more recently than I have in the past. I think that with pharmacy, the sad part is in many instances or in most countries around the world, the pharmacist kind of has a role of a glorified shopkeeper and has and really has lost that connection with the patient and is not really applying his or her extensive knowledge of biochemistry in healing. And I think that for me, I don't regret it. I love pharmacy because I think pharmacy opens so many doors for you. You can literally choose to work in a hospital and take that path. You can work in a really retail pharmacy. You can work in research. You can work in the industry. You can work in consulting. And then you can take the route that I've taken into functional medicine, or you can even dive into conventional medicine. I mean, it opens so many doors. So I think it's a wonderful foundation to have. But I think that for me, I was always searching for more.
Okay.
So while it was satisfying, it just wasn't fulfilling enough. So that's why I kind of kept going for the next thing and the next thing and the next thing until I landed into functional medicine.
Sure. No, okay, no, that makes perfect sense. I was just thinking because, like you said earlier, it's how you described it, that you could give someone a pill and they could have such a huge effect on their body and like heal them in multiple different ways. So I'm not familiar, so I was curious to see what you would say. So as a doctor, do you have as much of a, I guess, background or knowledge about the actual chemistry of like medicines and so on, or are you more focused typically on treating, I guess, symptoms and diseases from a, I guess, more of a theoretical standpoint? Like I come in, I have, let's say, a chest pain. Okay, what are the symptoms that it could be? 1, 2, 3, and then you apply the medicine to it. So what's the difference between the two?
Right. So in the conventional setting, that is the approach. The approach is a patient comes in, you ask what their symptoms are, you match it to a particular disease, and then you attach the medicine to that disease because medicines are approved based on their indication for a particular disease. Some are used out of label, and that depends on the skill and knowledge of the practitioner. But in general, that's the name of the game. And really conventional medicine was first came about because it was about acute medicine. It's you got an infection and you got treated with antibiotics and then you're fine. But when it comes to chronic conditions, that model doesn't work very well because chronic conditions are not infections. They're not acute infections. By nature, they're imbalances that have occurred in your body over years due to trauma or choices you've made around nutrition, exercise, your pattern, sleeping pattern, infections in the past, so on and so forth, that have led to inflammation that is now translated into dysfunction, right? Whether it's diabetes or cancer or arthritis. And so when we put on the functional medicine hat on, we look at the body as a whole system. It's an integrated system. We don't look at it as organ specific. We're not interested in how your heart is functioning versus how your kidney. We're actually interested in how your circulatory system is working, how your immune system is working, how your assimilation and digestion is working. So if we look at it's a systems biology approach to medicine, where we're trying to identify the root cause of disease as opposed to the symptom, and then let's just match a drug to it. So more often than not, we're not actually treating with medications per se. We are treating with supplements that are essentially natural ingredients that exist in your body. Sometimes we use herbs, and sometimes we use pharmaceuticals. But essentially what we're trying to do is bring your body back into balance.
Okay. So that's really interesting that, because when I was speaking to Yasmin about it, and she mentioned that you guys walk through, like you said, like you take the whole patient history, kind of like your life and things like past experiences and so on. It just blew my mind that that could still affect you now, because I think that over time, if you have been, I guess, doing the right things, taking care of yourself in the way that you think you should, those problems wouldn't be there anymore. So it's fascinating that it still carries through. And one thing that I've noticed speaking to a couple of different people on the podcast, and a woman I had who's an occupational therapist, and she said something similar to you in the sense that looking at it from a in a holistic manner. And
Mhm.
and that's something that seems to be, I could be wrong, but from my perceptions, it seems to be growing, that I guess that ideology of taking a more holistic approach to medicine in general. So why do you
Yeah.
think over the last, I guess, maybe like 10, 20 years, because I think in the past maybe it wasn't such a relevant topic, but now there seems to be a lot more awareness about it, and people are starting to realize that you have to start looking at, like you said, as the body as like an integrated system, and there's so many different moving parts that affect one another. So what do you think about that?
Yeah, so I think that the reason we have moved towards that is because the way the system is set up. The system is set up to, treat and move on, treat and move on. The healthcare system is really not designed for prevention. It's not designed for optimizing health. The definition of health in our healthcare system is the absence of disease. But that's not health. That's just baseline, is absence of disease. Health is a state of constant vitality. So what we've been focused on as a result is kind of a transactional model to healthcare, right? Whether you're talking about insurance-based system or you're talking about private out-of-pocket, or you're talking about national insurance, it's all about numbers, right? It's number and volume, and as many patients as you can see, and as many patients as you can treat as fast as you can. So I don't really blame my colleagues in conventional medicine, because they don't actually have the time to spend with their patients, to get to know them, to build that relationship, to understand what led to their illness, because they have 10 minutes. What can you do in a 10-minute consultation? Not much. Although there's wonderful work that Dr. Rangan Chatterjee is doing in the UK, where he's trying to teach general practitioners in that 10-15-minute consultation how they can effectively get to a glimpse of a root cause for a patient, for example, with diabetes, by simply asking, tell me what a typical day in your life looks like. Because a typical day in your life can tell us so much. It could tell us about your eating pattern. It can tell us about your sleep pattern. It could tell us about your stress levels, whether you're lonely or have good social connections, do you hydrate well, and so on. All these habits, all these things that you do on a daily basis are actually biological messages that you're sending to the body.
Okay.
Even the thoughts that you think also translate, it also translates effectively into biological messages in the body. So it's important. That's why we are where we are now, where people are looking for alternative solutions, because the current model doesn't serve people anymore. We have an epidemic of chronic disease. It is just, wherever you look, there are people with chronic disorders. And it's even in children. I mean, by 2025, the predictions are 8 in 10 children are going to have some form of chronic disease. And
Wow.
that's staggering statistic, and it's really scary. And the
Wow.
reason for that is because of our lifestyle and the environment that we live in. It's highly inflammatory, so much pollution. And so the conventional setting, where it's like, we'll wait till you get sick and then we'll treat you, is no longer going to be enough. And it's actually crippling governments, because we can no longer sustain the healthcare expenditure with this a huge increase in chronic disease. So we've got to figure out a better way. We've got to look at prevention, not just treatment.
Yeah. And I think you mentioned such a good point that conventional medicine is more about, like you said, transactional. When you're sick, you come and we take care of you, rather than, like you said, it's about curing, not prevention. And like you said, as if that's the statistic, that an 8 in 10 children are going to have that kind of disease in the future, then like you said, 100% something's going to need to change, because medical costs, like you said, are going up all the time, even here, like around the world. Like I know in the States, the cost to do a certain procedure, if you did it there, whether or in a different part of the world, it's like 3 times as much or something. So people also can't even afford to do those kind of things anymore.
Yeah. And I think just to highlight a point around conventional medicine, I mean, conventional medicine is incredible because without it, we don't have this expanded lifestyle lifespan that we have, right? People live longer. They're able to cope with diseases in the past that would have killed you right in your 20s or your 30s. So it's incredible. It's amazing in situations of trauma or acute setting. I mean, it is incredible and we need it and we've learned so much from it, but it's not as effective when it comes to chronic conditions, right? And that's where we need to look at integrative medicine or functional medicine and I don't like the labels, to be honest, because it's all medicine. It's just we have to learn how to use the right tool depending on where the patient is on the illness to wellness spectrum.
Yeah, so like you said, sounds like there needs to be an integration or some sort of a balance, depending on whatever the case is or whatever the patient has. Like you said, to use the right tool, I think is the best way to put it.
Yeah, exactly.
Yeah.